am optimistic about healthcare moving forward. I think that we finally turned the corner and are facing a very daunting problem. I think that technology has taken us to a level, or has gotten to a point that has lowered barriers of entry and information flow that has been unattainable until now. So yes, I'm very optimistic.
There are a lot of exciting things happening. It's part of what I love about being at TEDMED and talking to people and seeing all the innovation and the things that are coming down the pike in the future that we so easily get stuck in what we read in the paper and all of the political negotiations that are going on. But if you can get outside of that and see all of the amazing innovation that's happening in healthcare and the tools and technologies and even the knowledge and understanding that we have now that we didn't have 2-3 years ago, and you can project into the future 5 years, even 3 to 5 years, and see how much things are changing, it would be hard not to be optimistic.
I am optimistic about where we're headed. Certainly there are huge barriers. The official healthcare system is probably going to get worse before it gets better, but there's an increasing awareness of the fact that we need more innovation, more creativity, more user-centered design, patient-centered design in healthcare, and that's infectious and it's spreading.
I'm very optimistic about the emerging direction of healthcare. I'm happy with what's happening at the fringes. I'm excited by new entrepreneurial ventures around primary care. I'm excited by mobile healthcare, which is also primarily around primary care and chronic disease. I'm a little impatient. I think I could like to see it go a lot faster.
Every time there's change in the system, which there's massive change in the healthcare system right now, there generates the opportunity for growth and to make things better and new and fresh again. So with the Affordable Care Act sticking around, there's opportunity for us to make things improve on the healthcare we have right now, and then to create new platforms in which to provide care. So I'm absolutely optimistic.
If you were to ask me a few years ago how optimistic am I about the healthcare system, I would have said not very. But now I'm extremely excited because I'm seeing really disruptive innovations in the healthcare space that are bringing convenience to patients, really disrupting the care model so that the very complicated, intuitive care can be performed by physician-based teams, but the rest of it can be performed where the patients are. I'm extremely optimistic as we move forward with business partners, with tech, with innovative physician models.
Being at a gathering like this at TEDMED in DC, I've heard so many inspirational talks. I've seen so many leaders. I think it's hard not to be optimistic about the future of healthcare. I think the first thing we need to do is recognize there's a problem before there's any progress. And I think we've done that here. And because of that, I've seen all these leaders in completely different disciplines, engineering, design, and creative arts, coming together to address this root problem. And I think the future of healthcare is looking bright as long as we follow through with these ideas that are being spoken of here.